Aloha everyone, this is Dr. Zina speaking. Hope you're doing well. Today, my topic is going to speak about orthodontics. What is the difference between an overbite and an underbite? But before we continue, make sure to smash the subscribe button down below for more and more videos. Now, what is an overbite? From the name overbite, so there is excessive biting that is taking place. Why is that? Because the upper jaw is positioned forward as if the patient is going to eat something. So that is why it is called an overbite. If you notice that the overbite, it looks like you can see the upper jaw is positioned forward, so the patient is having a class 2 according to angles classification, class 2 division 1, in which the upper incisors are proclined. But in here, not only the upper incisors are proclined, here the entire upper jaw basically is proclined. So you can say proclination of the upper jaw is seen under the overbite. In comparison with an underbite, the patient has finished eating and he does not want to eat anymore. So that's why basically he has an underbite, in which the lower jaw is positioned forward, not the upper, because like you know, when you eat, the upper jaw first will hold the food, and then the lower jaw will help to attach the food together. So therefore, the underbite, there will be proclination of the lower jaw, which is similar, if you notice, to class 3 malocclusion, in which there will be proclination of the lower jaw. In comparison with the class 2, there will be proclination of the upper jaw at the end. So here is a clear picture representing the underbite and the normal bite. You can see under the normal bite, both the upper and the lower jaws are occluding with one another in a good harmony. In comparison with an underbite, you can see that the lower jaw is shifted more forward or positioned more forward. So that is the underbite, in which the patient, he does not want to eat anymore. So that's why it is an underbite. There is less biting on this side. Or you can remember it another way I have for you. When you start eating, first, like bring an apple and place it in your mouth. Who will hold first? See, who will hold first? The upper jaw will hold before the lower jaw. So when you eat, the upper jaw will move forward, or the upper jaw will hold first. So that is the overbite, okay, in which you are biting. But if you are not biting, then it will be underbite, in which the lower jaw will be positioned more forward. So this is like an easy way to remember it. Whenever you eat, the upper jaw will move forward. So this is an overbite. If you don't eat, the lower jaw will move forward, in which the lower jaw basically is not the dominant. Is not the one that will be holding the food when you eat. First, basically, the upper jaw will hold, then the lower jaw. Now, can you guess what is this? Is it an overbite or an underbite? It's underbite. That's correct. Why is that? Because you can see the lower jaw is positioned forward relative to the upper jaw, which means that the patient is not eating. That's why the lower jaw positioned forward, and this is called an underbite. Another pictures to further understand the difference between an overbite and underbite. You can see in the two pictures, the overbite on the right side and underbite on the left side, they represent the angles classification. Like for an overbite, it represents angle classification class 2. The patient is having a class 2. Skeletal malocclusion, we're not looking at his teeth, so that's why it's skeletal. Class 2 skeletal malocclusion, whereas underbite for the picture on the left, the patient is having skeletal class 3 because the lower jaw is positioned forward in front of the upper jaw. Now, I want to ask you, like if the patient is having an overbite and underbite, is it normal to have it? Of course, it is like the cause behind it is hereditary. Okay, is hereditary. It takes place like in if the parent is having any malocclusion in his face, in his teeth, most likely the child will be born with that. Now, anyways, if the patient is having an overbite in which the upper jaw will be forward, positioned forward in comparison with the lower jaw, the patient will end up having eating difficulty. How he can eat in comparison with the normal, but the patient is having normal. So he will have eating difficulty, and because the lower teeth, you see the lower teeth will be placed on the palate of the upper teeth because the upper teeth are positioned forward. So the lower teeth basically will be located where they will be positioned on the palate, on the hard palate. So this will cause frequent ulceration for the patient. Similar to what? Similar to underbite, but it is the opposite. It will not be the palate. The upper teeth will be positioned on the tongue, so the patient will frequently have ulcerations on the tongue area. So these are the complications if left untreated. So we need to provide treatment for such cases. What are the treatment options that we can provide, whether it is an overbite or an underbite? Now, the traditional treatment for an overbite is to provide braces. Most commonly for aesthetic reasons, we don't want like metal or stainless steel braces, the wires, I mean. So many patients are going for Invisalign, which is invisible braces, which is referred to as invisible braces. And from the name, Invisalign, invisible braces that will align the teeth together. That is the traditional treatment we provide for patients with an overbite. So it is the most common type of treatment for overbite. What about the underbite? For the underbite patients, if the patient is a growing patient, which means that 10 years and less, or for young patients, we prefer for them to place a reverse pull face mask in order to pull the lower jaw backward. That is the common treatment for young patients. What about if the patient is 20 years? What we will do for him? The same for an overbite. We will place braces. Braces if the patient is young patient, if the patient is like 20 years old. So for both overbite and underbite, we will do braces for them. But if it is like 10 years old, 7 years old patient, we prefer for them to give a reverse pull face mask because his jaws are developing or are growing. So it is the ideal time to place the face mask so that an immediate treatment will be seen thoroughly. Here is a picture for the Invisalign or invisible braces that will align the teeth. So it is an ideal treatment to be done for both an overbite and underbite for non-growing patients. Now, what about the children? What we will do, as I said, for the underbite, we will place a reverse pull face mask, which I'm going to show you a picture for that. Thank you all for watching my video. If you have any questions, please do write it down in the comment section below. Goodbye.